Hi, welcome to Nurse Ed Scholar. Let me say something that might surprise you. The NCLEX is not asking you to memorize electrolyte values. It's really asking you to recognize which electrolyte abnormality is the most dangerous right now in your patient situation. And if you've ever looked at questions and thought, well, all of them are abnormal, which one do I pick? This lesson is for you. Electrolytes overwhelm students because they often are taught a long list of this is the range, this is the range, this is the range, right? But the NCLEX doesn't test electrolytes as isolated lab values. It tests them as signals of organ failure. Okay. So the real question is which electrolyte abnormality threatens life first? So which one of them, if you're answering a test question, which one would threaten life first? So, you know, here's a rule that kind of simplifies everything. Electrolytes that affect the heart and the brain are always priorities. And so that means potassium, sodium come first. And calcium and magnesium, they matter, but they usually come after you rule out a heart and brain risk. Now, potassium. Hopefully, if you don't know, you will learn very quickly in school that potassium is the most dangerous electrolyte. And it's the one that NCLEX cares about the most. And so you wonder why. Because potassium controls cardiac rhythm. Both a high and a low potassium can cause lethal arrhythmias, sudden cardiac arrest. So when you're looking at a patient, and then I guess when you're answering NCLEX questions, the red flags for potassium: does the patient have an abnormal heart rhythm, muscle weakness, EKG changes? Are the lab values for that potassium trending up or down quickly? So on the NCLEX, potassium problems always, I don't like to say always, but more often than most, outrank all of the other electrolyte abnormalities. Because if the potassium is off, that's where your attention should be first. So, when you're thinking about potassium, you wonder, okay, potassium is dangerous. Why is it dangerous? So here is something that the NCLEX expects you to know, even if it's not directly stated in the question. Potassium is never, never, never given IV push. I mean, never. Okay. And even if you have the potassium on a pump, if it's given too fast through an IV infusion, it can be just as dangerous. You know why? Because potassium directly affects cardiac conduction. If potassium enters the bloodstream too quickly, it can disrupt cardiac electrical activity. It can cause lethal arrhythmias. It can lead to sudden cardiac arrest. So when you're looking at NCLEX question, this will show up like a safety trap. They may give you a question that talks about potassium and, these things that you have to know. So if you see a question on NCLEX and just say it's an order from a provider, if you see that the potassium is ordered IV push, if the potassium is ordered in a rapid IV infusion, if the potassium is being hung but there's no pump and the patient isn't on a cardiac monitor, then the order is unsafe. So if you see anything like that on NCLEX, it is unsafe. One thing I do want to say is that potassium, if it is, they have a certain rate. So if it's a 100 milliliter bag, they typically have it run over an hour. And that's 100 milliliters an hour. So that'll be on your pump. And then also, um, patients may complain that it stings a little bit. So you can slow down the infusion because you want it to be comfortable for the patient. But that's one thing to know. Okay. So when you see an unsafe potassium order, the correct action for you as the nurse is to question it. Like, this is wrong, and definitely hold it. Don't give it, call the provider. Because on the NCLEX, it's testing whether you recognize how potassium is given, and why it is so important. Okay, why is it important to be given that way? Remember that potassium must be diluted. It's infused slowly, so typically over an hour. So you'll see it in a 100 milliliter bag, and it goes over 100 milliliters an hour. Your patients are typically monitored. They should be because the heart can't, tolerate rapid potassium intake. Sometimes on the med surg floor, your patients will not be, or a surgical floor, your patients will not be on cardiac monitors sometimes. But you still have to be able to, you're taking vital signs, you're assessing your patient, and you're making sure that the infusion is not going too fast. Because, if a potassium level is abnormal and it's being administered unsafely, then you have to recognize that it is definitely a priority concern. So now we're going to move on to sodium. Sodium is tested, when you look at neurological status. If you may have heard in class, well, the patient had hyponatremia, so you have to watch out for mental status changes. So when you're looking at the NCLEX wants you to know when sodium is abnormal, is this affecting the patient's mental status? Is there a risk for seizures? Um, is this change rapid? Like, were they within normal limits and now they're not? So red flags for sodium would be, does the patient have confusion? Is there lethargy? Do they have a headache? Any seizure activity? Or was there a rapid change in the level of the sodium? Because if a patient has an altered mental status, then sodium becomes the priority. Now let's go on to calcium and magnesium. They affect the muscles, the reflexes, and rhythm. They're usually tested as secondary dangers. So when what the NCLEX is looking for, it's looking for, is there muscle twitching, hyperreflexia or hyporeflexia, tetany, or a prolonged QT interval. They matter. I mean, they're just as important. But if potassium or sodium is also abnormal, then typically those two come first. Typically. Now, calcium and magnesium has a relationship. They are partners in neuromuscular stability. Okay. And it's an important relationship. And the NCLEX wants you to recognize calcium and magnesium work together to regulate muscle contraction and nerve transmission. So when one is abnormal, the other is often affected. So the relationship is that if your magnesium is low, it can cause a low calcium. So when you're treating the calcium, it may not correct itself, because the magnesium is abnormal. And it matters because magnesium stabilizes neuromuscular activity. So without adequate magnesium, the calcium can't work properly. Okay. So if you have a patient, let's put it together. If you have a patient that has muscle twitching, they have tetany, seizures, or a prolonged QT interval, and the labs show a low calcium and a low magnesium, the NCLEX expects you to recognize magnesium often needs to be corrected first. This is a classic NCLEX integration point. Okay. And why does this matter? Okay. Because if calcium and magnesium are both abnormal, magnesium is often the underlying driver. So correcting the magnesium helps stabilize the calcium. Ignoring magnesium can delay improvement. So that's why on the NCLEX you may see which order should the nurse implement first, and magnesium is the correct answer. And when we're looking at trends, one of the biggest NCLEX traps is focusing on one number. And you'll hear this throughout the series. The exam loves the trends. Potassium rising, sodium dropping quickly, calcium gradually declining. And when you see this, you have to ask yourself, is this making the patient worse? Is this getting worse? Because a trending abnormality is more dangerous than a stable one. Okay. So let's look at it. You have a patient. They have a potassium of 6.1, a sodium of 130, and their calcium is slightly low. So which one is the most concerning? You have a low potassium, you have a low sodium, and you have a slightly low calcium. Well, with this one, potassium. That's the most important because it threatens the heart right now. And this is how the NCLEX wants you to think. How do you determine which electrolyte? Which one do I use? So kind of think of it this way. First, does it affect the heart? Second, does it affect the brain? Third, is it trending? Fourth, is the patient asymptomatic or are they symptomatic? Okay. And that framework will kind of guide you through most of your NCLEX questions. So that's it. The electrolytes, hopefully don't make you panic. And if they do, you're not alone. This lesson was mostly about recognizing dangers. It's not memorizing tables. It's about recognizing what to do when you recognize trends with your electrolytes. So the next lesson, I'm going to tackle ABGs. So please subscribe so you don't miss it. Download the workbook at Nurse Ed Scholar. And really, I'm doing all of this to help you study smarter so you can definitely test like a pro. So until next time, happy studying.